Let us say you are living with someone who suffers from epilepsy. Let's say you have a friend or you know a colleague or even a neighbor that suffers from fits. Did you know that a whopping 125,000 people die every year worldwide due to this vicious condition? In today's episode, we are going to be looking at the different causes of seizures as well as treatment. I'm talking what to do in case someone has a seizure while you are there. Welcome to another episode of Awareness by Insimbi Yolwazi Training together with Felix Driving School. In the description below, you'll get to know the other accredited courses that we offer. Remember to catch us or follow us, like us on Facebook, Instagram, TikTok, and YouTube for more videos and more information. Now let's look into the causes. The first cause that we're going to be talking about is the very common one. High temperature or high fever, especially in children. Parents, once your child catches fever, do something about it before it gets to a stage where a child progresses to having an episode or of a fit or a seizure. The second one can be grouped into three. The brain tumor, brain injury, as well as brain infection or infection in the brain. The reason why I'm grouping these three is because let's remember the definition of seizures. It is a sudden, uncontrolled electrical activity in the brain. So all of these three can actually cause or affect that sudden, uncontrolled electrical activity in the brain, which is a result of seizure, or it's going to result into seizure. I know a couple of people after an accident that they suffered from a head injury from that accident, after assault where they were hit hard in their head. I know different boxers, people that have been involved into boxing activity or boxing sport. After a long time, especially when they are aging, they may develop into seizures, or they may develop episodes of seizures due to the injuries that they suffered during the sport. The other one that we're going to be looking at is basically alcohol misuse. Guys, remember, if you are taking alcohol, you must be careful, because once you misuse alcohol over a period of time, this may be a result. This is a condition, guys, that is not curable. You can manage, you can control it, but this is not a curable condition. But I know with medication, with a proper diagnosis, you can control it. And now the lifestyle will have to change once you are being diagnosed with it. Now let's look into what can you do if you are there. Remember, if you are there first, I call you the first aider. The difference is, do you know what to do after calling an ambulance? Because I still encourage you to call emergency medical services. But now my problem, or where I come in, is immediately after calling and the arrival of an ambulance, what do you do in between that time? And that time can be longer because of the overwhelming calls that our EMS metro guys or EMS ambulances, even private, are sometimes getting, which can actually lead into the delay. So I need you to be equipped with information so that you know what to do and not cause more damage to the person who is suffering from this condition. Please understand that there is nothing you can do to stop a seizure from happening. Let me reiterate. There's nothing you can do. You can't stop it. So refrain from opening those stiff hands, the clenched hands. Refrain from pulling tongues. Some people make this dangerous activity of putting a spoon inside the person's mouth because, I'm worried that the person might chop off their tongue. In history, there is no confirmation of anyone that has chopped or bitten their tongue and chopped it off. There's no smelly shoe that you can put inside, close to the mouth or the nostrils of the person, that can stop a seizure from happening. Refrain from strangling the person. Refrain from tying the person with ropes and try to strangulate that person, because you are trying to prevent them from hurting themselves. The best thing you can do is to safeguard. If they have not fallen yet, try to ask them to politely sit down or lie down. Make sure that you don't allow them to lie on their back once they are done. Try to put them on their side. In first aid, we call that side or that kind of position a recovery position, so that they don't choke from their own saliva. If they did bite their tongue, they're not going to chop it off. Just make sure that the blood or the foamy blood or saliva that comes out of their mouths does not choke them. Open the doors, open the windows, make sure that there's fresh air in the room, so that these guys, after the episode of 2 minutes, they were not breathing for 2 minutes, at least after that duration, when they start breathing again, there will be enough and sufficient oxygen in the room. Okay, let's leave it there for today, and I will catch you on the next video. Enkosi kakhulu.